So good morning, good afternoon, good evening, and welcome to World Sickle Cell Day Global Dialogue 2021. We have guests joining us from different countries of the world, and we thank you for sharing part of your June 19 with us. For those who do not know me, my name is Lanare Tunji-Ajayi, and over the years, I have worn many hats and been in different roles, both in the Canadian and the global sickle cell community. My co-moderator today is Dr. Madeleine Verhofsek. She is the Chief of Medicine at St. Joseph's Hospital in Hamilton, Ontario. Today in Ontario, we mark the first Provincial Sickle Cell Awareness Day. And we know that effective advocacy have helped us to achieve this feat. Similarly, in 2017, we achieved a similar feat at the national level. As such, we believe that one of the good ways to spend today is to bring seasoned advocacy experts together to share their best practices, and we hope you will learn from them, be inspired and motivated. Before I hand over to Dr. Madeleine Verhofsek, I would like to recognize the presence of some of our board members attending today, and also Ms. Jenny Gums, who has served as the chair of the board of the Sickle Cell Disease Association of Canada since 2016. Dr. Madeleine Verhofsek, thank you.
Thank you very much, Ms. Lanray. And do we have slides for our land acknowledgement or housekeeping, or shall I just speak freely? Okay. So I'm logging in today from Hamilton, Ontario, Canada. And here in Canada, following the Truth and Reconciliation Commission that looks very carefully at how we have historically treated our Indigenous peoples. There has been increased recognition and importance placed on recognizing the lands on which we are sitting and standing and the history there. So here in Hamilton, this is the traditional lands of the Haudenosaunee and the Mississauga nations. And through this process, we are not only seeking to recognize and reflect on how Indigenous peoples have been treated historically, but also looking most importantly to improve upon this and working together alongside them to support them thriving in their independence. As well, I'd like to just address some housekeeping. We have a tremendous panel of people from around the world for which we are so grateful and very excited to hear about the work that's happening both here at home and elsewhere on this World Sickle Cell Day. I would ask, I think each of our panelists, we'll keep our individual mics muted when we're not speaking, and then of course unmuting when it is our turn. For the attendees, we will have all kinds of opportunity for you to engage with our speakers and panelists. So I would kindly ask if you can use the Q&A option if you have questions for individual panelists, and please indicate who those are directed to, if it's a specific person that you have the question for. You may also use the chat, although the chat may be more useful for things like if you're having difficulty hearing somebody or more live questions, so that we can enhance and ensure a good quality experience for everybody today. And so with that, I will hand it back over to, or actually I will be handing it over to Ms. Ruji Jallo, who will be addressing us on behalf of the Sickle Cell Disease Association of the Atlantic Provinces, and will be sharing recognition of our program sponsors.
Thank you. I am Rugi Jallo, the president for the Sickle Cell Association of Atlantic Canada. And again, welcome. Thank you. I would just like to reiterate that. What I am doing today is actually to recognize the contributions of our industry partners. When I say our, I mean SCAGO, to the success of the global dialogue. Sickle cell disease advocacy best practices. Your contributions and collaboration have made today's event possible. We recognize and thank you, Pfizer Inc., Novartis Inc., and the Global Blood Therapeutics. Thank you so much for all of your contributions you have made over the years. On behalf of SCAGO.
Thank you very much, Ms. Rugi, and thank you to our sponsors. Next, I'm tremendously pleased to welcome and thank Ms. Senator Jane Cordy, who's joining us, and she's going to have a few moments to speak with all of us. She is the past chair of the Canadian NATO Parliamentary Association, and she served as an international vice president of the NATO Parliamentary Assembly, representing North America on the executive. In terms of her work with sickle cell organizations, she has been a tremendous advocate, ally, and co-conspirator. From 2016 to 2017, she worked with the Sickle Cell Disease Association of Canada to introduce Bill 211, calling for June 19th to be recognized in Canada as National Sickle Cell Awareness Day. And that was a successful endeavor. Here we are again on World Sickle Cell Day 2021. Welcome you, Senator Cordy.
Thank you. Would you like me to speak now? Thank you. Thank you very much, Ms. Lonray and Dr. Madeline, and thank you to the Sickle Cell Awareness Group of Ontario for inviting me to take part today. It is a thrill indeed to be back again. I'd like to begin also by acknowledging that I am joining you from Mi'kma'ki, the ancestral territory of the Mi'kmaq people. It's great also to see faces from yesterday who were on the panel for the Sickle Cell Association of Atlantic Canada, and it's nice to see you again today. It's truly a pleasure and an honor to be here this morning to celebrate with you National Sickle Cell Awareness Day in Canada and World Sickle Cell Day, and to join in the conversation of sickle cell disease advocacy best practices. And it's so nice to see friends celebrating this day together. It's been a difficult year for so many people, and having the opportunity to gather even virtually is uplifting. And it's nice to see all these faces that I see every year on June 19th and in between times on Parliament Hill when you come to tell me more about sickle cell and where you want to go. And I see today that we're joined by advocates not only from across Canada, but advocates from around the world. So that's really terrific. So many wonderful people are here today who are making a difference in the lives of so many people who have sickle cell disease and in the lives of their families. You are amazing and you are very caring people, and I thank you. We're here today to share our stories, to exchange ideas and best practices, and hopefully use what we hear today to apply to our advocacy work. Community advocacy is at the root of so much change in our society. Since my journey began helping to raise awareness of sickle cell disease in Canada, I've had the pleasure of attending many sickle cell awareness events. First, listening to advocacy efforts like yourselves, and then as a partner to help raise awareness of sickle cell disease on Parliament Hill. So today I'll speak from the perspective and from the experience of how important it is to build relationships between grassroots advocates and policymakers to ensure the success and to ensure that you are telling us what we have to hear about, and that's truly the importance of community advocacy. My journey began with a Sickle Cell Advocacy Day on Parliament Hill, an information session hosted by the Sickle Cell Disease Association of Canada. At that event, it was where I first met Ms. Lonray, who was president at that time of the Canadian Association. Attendees were given a briefing on the disease and the realities that Canadian families, in particular children, face on a daily basis, coping with sickle cell and the challenges of treatment. It was very moving for me to hear those stories. Following the session, when I was formally introduced to Lonray, I told her that I would be willing to help in any way that I could. Of course, Lonray accepted my offer, and almost immediately we started working together on legislation to raise awareness of sickle cell disease across Canada. As Lonray and I started working together, we had many discussions on what's the best way forward. As healthcare is primarily in the jurisdiction of the provinces and the territories, Lonray and I determined the most appropriate measure or the starting measure, by the way, is to pursue on the federal level something that would draw attention and raise awareness of the disease with the Canadian public, while at the same time respecting the jurisdictions of the provinces and territories. In the end, we decided a good first step would be a bill calling on the Government of Canada to officially recognize today as National Sickle Cell Awareness Day. On June 12, 2017, the legislation became law. And I tell you all this to help highlight the importance of relationship building and focusing grassroots advocacy play in influencing public policy. Meeting Lonray at that briefing and the resulting legislation didn't just happen by accident. It happened because so many people like you want something to happen. And so many, like Lonray, are tenacious and passionate. The Sickle Cell Association were in the same room as the decision makers, and they were able to capture their attention. They knew what they were looking for when they organized Advocacy Day on Parliament Hill. They educated parliamentarians, but more importantly, they told their stories, because that's what touched my heart. I'm speaking from my personal experience of listening to advocacy moments on the Hill. After our first meeting, Lonray and I had many conversations. She was the expert on sickle cell disease, and the Canadian Association was able to use my experience as a parliamentarian to help them better understand the realities of the legislative process. The exchange of knowledge was essential to accomplish our goals, because those not involved in the legislation process think that things can happen. If you talk about it on Monday, it can happen on Friday, and that's not the reality. In fact, it took Lonray and I almost 2.5 years to pass our bill into law. We faced hurdles along the way, not to mention the slow legislative process, especially when it's a private member's bill. It's not a government bill. And there was an election in between. But during that time, we kept the conversation going in Parliament and with the public, which is exactly what this bill is designed to do. It meant that Lonray and I had the opportunity to speak about sickle cell at a televised Senate hearing in Canada. It's so important to always, always, always keep the conversation going. Many people are looking for a way to help, and your stories may get them involved. I've said this before, and I know it's a cliche, but advocacy, and particularly advocacy influencing public policy, is a marathon and not a sprint. It takes a long time, and there are lots of frustrations. So it's vital when you're trying to persuade public policy to reach decision makers directly on a personal level. And that's why I keep saying, tell your stories, tell your stories, tell your stories. The Canadian Association was able to achieve this through their advocacy days on Parliament Hill, where they educated parliamentarians who heard about the experiences of living with sickle cell disease. Most advocacy associations are made up of dedicated volunteers who do this amazing work in their, what we'll call their free time from everyday life of family and work. They're often people who are personally and emotionally affected by the causes they advocate for. This personal investment in their causes can sometimes come at the price of emotional or mental stress, particularly when you're facing setbacks or disappointment when advocating on behalf of loved ones, because that's your cause. You know why people should all listen to you. And when it doesn't happen immediately, it can be frustrating. So my advice is to set short-term goals or milestones along the way so that it helps to keep disappointments and frustrations manageable in the long term, and it helps you to keep from getting too discouraged. Each step forward creates change. And I look back and see what your advocacy has done in achieving so much over the past few years. Sometimes we don't look back. We're always looking at the next road to cross, the next mountain to climb. But sometimes we have to look back and say, you know what, we're really doing a pretty good job. And I can't express how much of a pleasure it was for me to be here with you today. I'm thinking of yesterday. I can't express how much of a pleasure it is for me to be with you here this morning and to celebrate with so many friends on National Sickle Cell Awareness Day. I look forward to listening to the guests who are with us today, and I'm hopeful that we'll be able to get together in person soon. Thank you very much.
Thank you very much, Senator Cordy, and I'll hand it over to Ms. Lanre.
Thank you very much, Senator Cordy. And honestly, your speech brought fond memories of those days and working together on the Parliament Hill. Thank you so much. I'd like to introduce Member of Provincial Parliament, Rudy Cacheto, as our next speaker. MPP Rudy Cacheto is serving Mississauga Lakeshore area, and he worked with the Sickle Cell Awareness Group of Ontario and the Thalassemia Foundation of Canada to co-introduce Bill 255, an act recognizing June 19 as Provincial Sickle Cell Disease Awareness Day and May 8th as Thalassemia Awareness Day. Currently, he is member Standing Committee on Estimates. He's also member on Standing Committee on Public Accounts and is parliamentary assistant to the President of the Treasury Board. I'll introduce now MPP Rudy Cacheto. Thank you.
Thank you. And I'm Rudy Cacheto, MPP for Mississauga Lakeshore, and I want to thank Landry and the Sickle Cell Awareness Group of Ontario for organizing this event and all your support. And thanks to the panelists here today from around the world. Thanks most of all to the patients, doctors, and families who reached out to us to share their stories. And I was so honored to be part of this with the MPP from Barrie Innisfil, Andrea Kanjit, and Lowry on this Bill 255, which received royal assent earlier this month. And it was a push from our Premier, Doug Ford, because this is a private members bill, and it was very difficult, like Senator was saying, to get private members bills through. And the Premier was really enthused to get this bill through as quick as we can. And it looked like we got it through in 3 months. So thank you very much to everyone for being part of this. Every year in Ontario, moving forward, June 19th will be the important opportunity to raise awareness of the most common inherited blood disorders and the most common inherited disorders in the world. That includes all the challenges families can face with confronting this disease, including stigma and discrimination that can create barriers to getting the care you need. For far too long, there hasn't been enough research or education on the treatment and the management of sickle cell disease. It lags far behind other critical illnesses. And fortunately, that's beginning to change here in Ontario. And I'm so honored to be a small part of this change. My community of Mississauga Lakeshore is one of the most multicultural communities in Canada. Many trace their roots back to India, South Asia, Africa, the Caribbean, and the Middle East. And unfortunately, more and more, we're seeing the impact of sickle cell disease. Earlier this year, the government announced that Mississauga Hospital, where I was born, will be getting a complete rebuild in Mississauga. It will be the largest hospital in Canadian history. And I'm so proud of that hospital, not only because I was born there, my mother worked there as a first-generation immigrant in the kitchen. So for me, it's a proud moment to see that hospital being rebuilt. And I'm confident as we move forward, our new hospital and our healthcare system will include a comprehensive, specialized care for both adults and children with sickle cell disease. It is a true creating a day of awareness was just a small step, but it is an important step. And I look forward to working with my colleague, Andrea Kanjit and Lowry, as we all move forward and moving this even more further. So thank you very much for having me here today. And it's an honor to be here with all of you.
Much. We thank you, Member of Provincial Parliament Cushetto, for all of the help you've given our community. Thank you so much. While Member of Provincial Parliament Andrea Kajin wanted to be with us today, she's not able to, but she'll send a video, and we'll be playing that video now so we can all listen to her message. She represents Barry Innisville, which is where I live. And in collaboration with MPP Cushetto, co-introduced Bill 255. And it's really an honor to work with this lady, who is also the current parliamentary assistant to the Minister of the Environment, Conservation, and Parks. Thank you.
Hi, Sandra Canton here, MPP for Barrie Innisfil. I want to thank you so much for putting on this conference, and I'm just forever grateful for the day that I met Lanry from the Sickle Cell Awareness Group of Ontario. I will never forget that day. It led to the passage of now a great Prime Member's Bill in Ontario, which declares Sickle Cell Awareness Day and Thalassemia Awareness Day. I did in partnership with my colleague Rudy Cazzetto, and we're happy to see not only did this pass, but to remind ourselves that, when we celebrate thalassemia on May 8th, it's not just a day, it's the people behind it. It's the people who have to struggle with thalassemia. It's the people we may have lost because of it, but also the future of how we help cope with the particular blood disorder. Same with sickle cell. When we celebrated on June 19th, today, we can think about, paying tribute to, unfortunately, those who we've lost, but also looking towards the future of how much research we have and how much screening now we do with the newborn screening. Now that we have the handbook as well, which I know Landry has worked on as well, and of course the future that we're going to be working on together. So I hope together that we accomplish more when it comes to the sickle cell and thalassemia file. I've been diligently working with Landry and Rudy to really make progress on the file, not just for the Prime Member's Bill, which we passed for a day, but of course breaking the stigma when you go to the emergency room so that you get the care that you need and it's not stigmatized and you get the pain relief you need. And there's just so much more. But I'm forever grateful for everyone who's part of this conference, the doctors that give up their time for the research and the time for their patients, and of course all the families that are affected. So thank you so much from the bottom of my heart. I look forward to continuing to work together.
Thank you very much. And on this note, I will hand back to Dr. Velcek. Thank you.
Thank you very much, Ms. Lanre, and thanks to MPP Canton for those wonderful comments for all of us, and to both her and MPP Cazzetto for partnering so effectively on and efficiently on moving that bill through to make this day possible in Ontario. So I would now like to introduce Dr. Adlet Inati. She is a professor of pediatrics at the Lebanese American University and the head of pediatric hematology oncology division at the comprehensive sickle cell program at Nini Hospital. Her team provides comprehensive care to 1,000 children with inherited blood diseases and cancer. Dr. Inati received her medical degree from the American University of Beirut, completed her pediatric residency and hematology oncology fellowship at Johns Hopkins Hospital, Children's Hospital Medical Center, and Sidney Farber Cancer Institute, Harvard Medical School. She's American board certified and a member of the Alpha Omega Alpha Honor Medical Society. Dr. Inati has more than 80 publications, hundreds of abstracts, and is principal investigator in key sickle cell disease global trials. She is founder and president of GNK Foundation, which promotes free healthcare delivery and road safety. Her ultimate passion is mentoring young physicians to become expert scientists and compassionate healers. And we are absolutely delighted to have Dr. Inati here joining us today. Welcome, Dr. Inati, to speak with our audience.
Dr. Madeleine, thank you so much for your kind introduction. I'm really humbled, so happy, and so proud to be among this eminent team. Let me start first by acknowledging all the efforts, the compassion, and dedication that my friend Larry has done over the years, be it in Canada, or as a president of Global Alliance of Sickle Cell Disease Organizations, and now the president of Sickle. Let me also salute the efforts of Senator and Member of Parliament. I have been very touched with what you said. I've learned a lot, and I think I'm going to definitely help this as you move around in initiating a national sickle cell disease plan in Lebanon. I'm going to share my screen now, and just, do you see it well, please? Do you see it? Do you see my screen?
Yes, we can see it well. Thank you.
Great, great. So what I'm going to do today is to just share with you some sickle cell initiatives in Lebanon. Because of the shortage of time, I cannot dwell on the Middle East. Let me introduce you to my country. This is a small country, 6.8 million inhabitants. We do have 850 patients with sickle cell disease, and these are gathered in 3 centers, 2 major centers that are really in Nini Hospital, where I work, another in mid the country, Beirut, and few patients, around 200 patients, are gathered all over the country. Sickle cell disease care structure is offered in 2 private sickle cell disease comprehensive centers. Care outside, sadly, is fragmented, and the main stakeholders in Lebanon are healthcare providers. We do have premarital screening, but marriages between carriers are not prohibited. We do have neonatal screening. We've done it, and we'll talk about it later on. We do not have school screening. Most of our patients come from a low socioeconomic background, and more than 90% have originated from outside Lebanon, with sickle gene influx from surrounding countries. This is our first report, the first national report about sickle cell disease in Lebanon. And as you notice, in around 400 patients, most of our patients are homozygous for the SS. We do have concomitant alpha thalassemia in around 20% of the patients. But notice that consanguinity is so high, it's around 56%. Trying to get my pointer, okay. Sickle cell disease in Lebanon is characterized by geographical clustering. But what's quite impressive is that most of the haplotypes in Lebanon come from African haplotypes. So that's why I emphasize sickle cell disease in Lebanon is a gene influx from surrounding countries. This is a second important initiative in Lebanon, which is the newborn screening, which G&K Foundation embarked upon in every single public hospital in Lebanon. And the slogan was, "Save a life with a drop of blood." We screened more than 10,000 babies, which are quite representative in a small country in Lebanon. The total number of newborns, the hemoglobin variant, was 211, which makes around 2.1%. And in areas like North Lebanon, it was much higher. And the incidence of hemoglobinopathies was 0.1%. Even though hemoglobin S is the commonest, but for the first time, we have established in Lebanon other hemoglobins like D, C, and O Arab. And when we looked at those with disease, most of them have sickle cell disease, and it's quite common in every single part of the world, and 7% had hemoglobin DD. As I mentioned, sickle cell disease is different from thalassemia in Lebanon. It's characterized by geographical clustering. So let's see North Lebanon, where I work, where our comprehensive center is. Around 50% of patients do reside, whereas in internal areas in Lebanon, we have very few sickle cell disease, underscoring that it's a gene influx. And when people came to Lebanon, which is known for its geographical location, they landed on the shores. This is our third initiative, which is, there's in Arabic, but it says, know about it before it knows about you, about sickle cell disease. We really were very keen about spreading awareness education among high school and university students and public and high prevalence area. We did educate them, but we did also address a questionnaire for them to assess their current knowledge and how much they've learned from our awareness. So pre and post, we scored that questionnaire, and we targeted so far 85 schools, 7 universities, and 10 areas of high prevalence. So far, we've reached 20,000, but we're moving more and more to catch every single university student and high school student, to catch them very early. If you look at this, you see that knowledge about sickle cell disease is quite limited, even in a country like Lebanon, where education is very high. 2 weeks post, the knowledge, be it in high school all universities has really was relatively very good, a score of 9. But the good thing, because education awareness is continuing via social media, via so many platforms, it is still retained. So we're very positive. We're hopeful this education awareness journey will be a successful one. Over the years, we have noticed the impact of what we've done. The Sickle Cell Disease Comprehensive Program in the largest area of prevalence in Lebanon, Nini Hospital, followed by the Newborn Screen Program, has helped us catch so many babies with sickle cell disease. But hopefully the graph is going down because we have initiated the Sickle Cell Disease Awareness Campaign. People are more aware about carrier detection, about genetic counseling, which we do in these sessions. So we hope we'll be continuing to see the slope going down in new people with sickle cell disease in Lebanon. So what are opportunities for somebody with sickle cell disease in Lebanon? How are patients doing? We're glad to share that in Lebanon, we have treatment guidelines adhered in 2 expert centers. And when I talk about treatment guidelines, I talk about global treatment guidelines. We have been all trained in expert centers outside, and we have exported our knowledge and expertise to those in utmost need, people with chronic disorders. Around 80% of our population, the sickle cell disease population, do receive hydroxyurea, which, as you know, is the state of art in terms of treatment, the most important disease-modifying therapies, not to undermine all the novel treatment, which has been very effective so far. But treatment rate in periphery is likely lower. So we're establishing a network between the centers of expertise, the comprehensive centers, and the periphery. We want to catch every person with sickle cell disease and give them the best treatment possible. We do give transfusions, all kinds of transfusion, exchange, top up, intermittent, and chronic. What about VOC management, which is the most dreadful complication in sickle cell disease, be it immobility or mortality? Our team promptly assesses pain and introduces analgesia, and that means our comprehensive team, particularly those in the emergency room, we have worked a lot on stigma. We do not want anybody, do not accept any personnel to tell the patient, I do not believe you, or let them wait while they're triaging them. So we have a pain assessment tool, which is very prompt. We assess quickly, we introduce opioids or any kinds of peripheral parenteral analgesia very quickly in our expert centers. If patients are unable to reach, especially with the COVID, we advise some networking centers about how to treat the VOC. And I think what's one of the most successful stories in Lebanon is our involvement in research. So we've had multiple global randomized clinical trials from phase 1 to phase 3 conducted only in the 2 comprehensive centers. And what's even better is that patients and caregivers are very well knowledgeable about the benefits and roles of trials. They do not look at trials as if they are trials on us. They look at them as trials for them. And I think this is a legacy that we need to propagate among patients with sickle cell disease worldwide. Over the past 5 years, we have done 26 studies in North Lebanon. Be it local or global, we've had 22 publications, mostly they're global. We are publishing in the presenting at the American Society of Hematology, European Hematology Association, and publishing in key journals, and at least 30, and by now it's 40 abstracts. Do we have PAGs? What about national policy in sickle cell disease in Lebanon? Unfortunately, up till this month, sickle cell disease was not a national priority. Policymakers knew nothing, they're not involved. But now we are initiating a national control policy, which we hope will be launched immediately within the coming month. PAG activity is growing, but influence is still limited. 2 NGOs fundraise and represent patient voices, George Nassim Khariat G&K Foundation, and I'm Sickle Cell at the American University of Beirut. Do we have challenges? Of course, it's one of the most challenging diseases, sickle cell disease. Limited awareness, we want it to be better. Variable disease management, we want it to be standard. But in the 2 centers, it is actually a lack of optimal transition programs. And I believe all over the world, this is a very high risk transition area. Limited newborn screening, we've done it before, but it's not part of the system in Lebanon. It is going to be initiated within the coming month. Low socioeconomic status of patients and social stigma, which I want to say that in Lebanon, it's becoming much, much less because patients are starting to advocate and their voice is very high. Let me end by saying all what we've done, the comprehensive sickle cell disease program at Nini Hospital, all national trials were fully supported by a fund from G&K Foundation, the foundation of my late son who died in a car accident. That's a Lebanese NGO that promotes health and road safety. Thanks again. It's a pleasure to be here and good luck in all your endeavors.
Thank you. Wow. Thank you so very much, Dr. Inati, for joining us all the way from Lebanon and sharing the experience that you have there with the patients and all the work that you do there to advocate. Many of those challenges that you listed there about sickle cell disease as a condition and trying to get attention, Sean, on it are very universal in my experience. And I think we're starting to hear that as we hear from around the world today. And with that, I would like to invite our next panelist. This is Ms. Laura Ruth Wogu. She is the founder and CEO of Sickle Cell and Thalassemia Ireland. She is also the Chief Operations Officer for the European Sickle Cell Federation, which is an umbrella network of patients and patient organizations advocating for sickle cell disease advancement in Europe, with one united, unique, and strong voice. Welcome, Ms. Laura, and we invite you to share your experiences and perspectives with our attendees today.
Thank you very much. Thank you, Ms. Lanre, for inviting me. And it's great to hear the many voices that have spoken before me. Thank you so much, Senator Jane, for what you've done for sickle cell and for thalassemia, together with MPP Rudik. We appreciate it, and it's actually amazing. So I've been already introduced. I'm just going to go straight ahead and mention, as I was requested, on how the European Federation was put together and what we plan to do. The European Sickle Cell Federation is really mainly about the patients and the patient organizations. It was founded by the patients, for the patients, with the patients, mainly to raise awareness on the conditions they are going through and the difficulties they are having. So it started early in 2019 when we all met at a Thalassemia International Federation event. And the idea behind that meeting was that Thalassemia International Federation was planning to create a group of patients under their umbrella. But regardless of that being a great initiative, it wasn't what the patients wanted, and it wasn't fair to the sickle cell community that sickle cell will be hidden under thalassemia. So patients, all that came from different countries, gathered and discussed through the various points that the Thalassemia International Federation gave us. We realized and decided that sickle cell needed a voice of its own. Sickle cell needed to be represented and it needed to be heard. The patients shared their own experiences on the difficulties they are having in their various countries in Europe and why they felt that this was the time to start an umbrella body and to all of us come together with one united voice. So as we left in October 2019, the decision was made that we were going to do it. However, it wasn't easy. It wasn't easy for the fact that not every advocate that was in that group was experienced enough on how to advocate, as well as the fears on what were we going to do. They feared the experience, lack of experience in international advocacy, lack of networks, lack of connections in political government. So the fear was huge, but we were blessed with the fact that I was there. I have to applaud myself, sorry. The fact that I was there, I brought my knowledge to show them that we can still do it. The patients can do it for themselves because it is important. So we started up, and in February of 2020, we had already decided. Unfortunately, COVID came along, so that kind of put all our plans aside. So as we went ahead, we decided that we would do it slowly by slowly. So June 2020, we had the organization registered, and it's officially registered in Ireland as an umbrella body for sickle cell. We have about 12 countries covered in the organization, and we have about 15 patients and 15 organizations represented. However, we still have about 5 organizations that are in the registration process. So next slide, please. That is just when we were in Hamburg, the beginnings of when we were discussing the potential setup of the federation. I call them beautiful beginnings. Next slide, please. Next slide. So the mission was really to bring together one voice together, which was a strong voice, and to fight and represent to represent patients in enhancing and promoting the ability to improve their quality of life. They felt that what they were going through, only them can understand, and they were not being listened to. So this in most cases is what the voice of the patient is to represent, what they want people to hear. They want to be understood, they want to be heard, they want to be allowed to make decisions in their own treatments and management. And this is why the federation was created. Next slide, please. So some of our objectives, of course, is to campaign for a national screening program. As we are all aware, the screening program is not in every country. Of course, in Europe, some of the countries are screening and other countries are only doing target screening, and some countries are not screening at all. So we hope and we plan to campaign for that in partnership with other organizations like EuroBloodNet, Eurodis, to push forward the screening program for all newborn babies. We also plan to engage patients to be partners in the development of new strategies, new policies, and new research in future treatments and management for sickle cell. This is where patients want to be part of what is being done for sickle cell. They want to be involved, they want to participate, but they also want to know what is happening, because as almost of the research is being done, patients are not aware. Many patients don't know. So they want to be able to know what is being done so they can, and how can they participate for their own benefit. We plan to promote and advance and encourage all our African and Caribbean brothers and sisters, the Mexican, Indians, all of us to donate blood and to register to be donors, because we have a lot of patients that could benefit from bone and stem cell transplantation, but they don't have donors. So if we all promote that and if we all register, we might be able to help one person to change their lives, and also to work with governments and stakeholders in Europe to ensure that all the services and treatments that are being offered are effective and accessible. Next slide, please. So why the patients wanted this was something that one of our representative, who is currently the president of the Federation, Sos Globi, and what she said as a patient is that they want to see themselves make the decisions that relates to their life, just as I mentioned before. They want to be able to take decisions and to be there and be included. Next slide, please. So this is a question I asked many of the patients, and some of those are all in the team. And what do they want to see done? And most of them, of course, our President Konsi was saying, I want to live a normal, long life. They feel that the life is not normal enough. And even with whatever medications and treatments they're being given, it's not enough to continue their life as a normal patient as everybody else. And most of them look forward to seeing that all the doctors understand sickle cell, and not to go to a doctor and your doctor is checking Google to find out what to do with you or what treatment to provide. So education of the healthcare providers and all those who are in the care of patients is really important. That's what patients are striving for. This is something they've met in various emergency departments. I think in Canada, you call it the ER. They found that most of the doctors don't understand what to do during a crisis. They don't know how to look after them or what to provide them to relieve the pain. So understanding and knowledge for all healthcare providers is important. Next slide, please. So what we are looking for from policymakers is mainly to the first and most four point is to recognize sickle cell disease as a public health priority across Europe and across the world, because sickle cell is not given the attention. Sickle cell is lacking. Sickle cell is ignored. Sickle cell patients are struggling. In the UK, we've lost a few patients. I think everybody has heard of the youth that died because the nurse did not understand that he was in pain and what he was needed, and he died in a bed in the emergency department, and that is not right. So we need Europe, or we need the global platform to understand that sickle cell is here and we all have to deal with it. We need the policymakers to make priority sickle cell disease. Just like they look after cancer, they should look after sickle cell. It's as important as any other disease. Next slide, please. So I'm introducing to you here the team. These are some of the people that we started with. Unfortunately, some faces are missing of those who joined us, but this is a group of 12. On the management, we have a group of 15 at the moment. And as I said, most of the countries are covered. What is most important in this slide here is that as you see me there, and this lady here, this lady here and me here, we are the only people who don't have sickle cell. So all those people in that group are all sickle cell patients. So it's important to understand that the European Federation is actually put forward by the patients for the patients, because they want to see things change. They want to see a difference made. Next slide, please. And I think I'll be finishing. The last slide. In conclusion, I'm just going to thank everyone, and mainly to thank Dr. Adleti for all that she's doing for sickle cell. 100 publications. Wow, that's amazing. I would like to thank Lanre very much, because she's been very supportive of the European Federation from the time that she was the president of the Global Alliance Sickle Cell Disease organizations. She's been great, and she's really focused on seeing a unity and how we can all work together. And I look forward to working with everybody. Thank you very much, and happy World Sickle Cell Day.
Wonderful. Thank you very, very much. Very inspiring to hear the work that you have done and continue to do to improve the care for patients in Ireland and across Europe. Thank you. Over to you, Ms. Lanre.
Thank you very much. And as Dr. Madeline said, we're very impressed by the work that you, Laura, and your team is doing in Europe. I mean, when I was the global president, I met with many of the groups in Europe, and it's very, very impressive to see that they wanted a change in Europe. And by coming together, we know that they will have that strong voice to make changes to happen in Europe. Without taking much more of our time, we will introduce our next speaker. But before I do, I just want to make sure that we remind everyone that we have 10 minutes cap for each presentation as much as possible. Please, thank you. And so we have Mr. Gautam Dangri from India, all the way from India. And I believe we'll be using a video presentation as well. But I believe he's also here with us today. Mr. Dangri is the secretary of the National Alliance of Sickle Cell Organizations, NASCO, which is India's first national patient advocacy group for sickle cell disease. In this role, he represents the government of India, the National Council, and also India's highest policymaking multi-stakeholder forums on sickle cell disease. I also want to mention that as each speaker are speaking, please try to put your questions in the queue box. We definitely will be looking at the questions after everyone has presented and taking them at that time. So we have Mr. Gautam Dangri. Thank you.
Ontario for having me here. In India, we have 1.39 billion. Good evening, everybody from India. Thank you so much, dear Landry and Team Sickle Cell Awareness Group of Ontario for having me here. In India, we have 1.39 billion population. We have 18 million people living with sickle cell trait in our country. We have 1.4 million sickle cell disease patients. Prevalence of sickle cell disease varies from state to state. There are 14 states where huge number of sickle cell disease patients, because percentage of prevalence is up to 40, whereas there are states where this number will be hundreds or thousands. But one thing is sure, that this disease is not restricted in one geography because of migration and many other factors. In our country, maybe 1.4 million is not a very big number. That is why even we don't have a national policy for sickle cell disease as of now. There are multiple challenges: availability of drug access to treatment, access to doctors, availability of diagnostic tests. So there are multiple challenges like any other country we also facing. What is discussed about situation? Situation was same for years. Like any other country in India, we also continue to get new childbirth with sickle cell disease. We also continue to pre-early deaths of sickle cell disease patients. Without of suboptimal treatment, because of non-comprehensive treatment, people continued dying. This was going on very recently last year before COVID pandemic hit us. We got a chance in India to meet with a patient advocates from many other states during a training program which was meant to empower and train sickle cell disease patient advocates. This was organized by Novartis. With the support of Novartis, and this training program was given by a prestigious business school, SP Jain Institute of Management and Research in Mumbai. When we came to this institute, the best thing happened is that we met with other warriors from other states. We realized that we are only aware about situation in our own state. There was some good and some bad things which was happening in different states. This occurs connected us. This course brought us together. We made a WhatsApp group of all the different participants. We started sharing our experience. We started sharing what is happening in our states. In 1 or 2 months, we started realizing that we are learning. We came to know that we have started knowing more about this disease. We have started knowing more about programs. Then we also realized that we are not united. We realized that we don't have a common voice in this country, unlike other societies, thalassemia or in hemophilia. There was no alliance, there was no organization of sickle cell disease organization, and we decided to be united. We decided to form an alliance of these organizations, and that gave birth to National Alliance of Sickle Cell Disease Organization in India. During pandemic, when we were struggling with multiple challenges, few of us took this lead and we formed first alliance of Sickle Cell Disease Organization, which is National Alliance on the day of our independence, 15th August 2020, in presence of Ms. Lanre, who is present on this forum with her encouragement in her presence. In the presence of Global Alliance of Sickle Cell Disease Organization, we formally announced the launch of National Alliance of Sickle Cell Disease Organizations, and then from that day onward, we have not stopped. We are continuing our journey. We started identifying one few major advocacy issues, and we started working on that. With lot of support from other members and stakeholders, we started getting visibility. We became part of various government bodies. NESCO was invited as a member in a National Sickle Cell Disease Council formed at national level. Ministry of Health, Ministry of Tribal Affairs, Ministry of Social Justice and Empowerment. All these officials and ministries have started recognizing us because we were together. In less than a year, we could be successful in bringing some changes in our issues. One of that I would like to share with you with very proudness. In India, we used to get disability certificate renewed every year, which was very difficult. Every year our warriors have to visit to district hospital to get themselves recertified. When lockdown was there, people were not in a position to travel. It was very difficult. We brought this issue with Ministry of Tribal Affairs, Ministry of Social Justice and Empowerment. I was invited as a member of that committee towards redefining these rules because of our application. And then few days back, I was told that now this rule has been changed. Instead of every year, we got first victory now. Every 3 years, this renewal has to happen. We are not going to stop here. We want to extend further, but we will do it step by step. We also started working with government and started asking more resource allocation for sickle cell disease in health budget. We also see that is also happening in many states this year. Voice and noise of sickle cell disease has started increasing. Today on 19th June, I am speaking here. I am very happy to tell you there were 5 more such national webinars, consultation and workshop happened in this country. On 19th June 2019, there was not a single national level meeting or workshop was organized in India. 2020, there was one. That shows this disease is become priority. Slowly but powerfully, the noise and voice of sickle cell disease is increasing, and in all these voices of patient advocate is present everywhere. There is no meeting which happens now in India where a member of National Alliance of Sickle Cell Organization is not present. We organized 2 national level webinars in last year. With 3 ministries, we did 19 days 19 story campaigns also. Countdown videos of 365 days to go, and also 7x7 fixed date, fixed time meeting on every month. This is our short and initial journey, but we have just started. We are beginners and we have only two objectives. One is to stop new sickle cell disease birth in our country. Second is to stop premature death in this country. And how we are going to do? We want to become voice of sickle cell disease organizations and sickle cell disease community of India. We need support of senior members like you on this forum. You all have been doing great work. As a new member, as a new alliance, we look for your support. We look for your guidance. We look for your hand holding so that together we start impacting lives of thousands and thousands of people in India, which is the second largest sickle cell disease population country in the world. We are in this together. Thank you for giving this time.
Thank you very much. That was very impressive. And that is an example of patient advocacy in a low to medium resource country. Go and close the door.
You're muted, Ms. Lanre.
Sorry about that. A little bit of disruption there. Sorry about that. I wanted to say that this morning I was actually in another webinar in India, and I can tell you that India is an example of a country in a low to medium resource country that has now understands the importance of working in a unified version to reduce fragmentation and get their voices heard. And as a matter of fact, a lot is happening in India, and it's amazing what they have been able to do and how they're working with the government moving forward. Now, before I introduce the next speaker, I wanted to quickly recognize the presence of Ms. Lewis Inert from Global Novartis. Thank you for being on this call this morning. We also have Dr. Melanie Kobi-Harling, Ms. Moji Ogunsanya, Dr. Dana Powell, Dr. Joy Mburu, all on SCAGO's board of directors. We have Ms. Rosemary Sadler. And I tell you, this woman is one person that I believe in the history of, the Blacks in Ontario and even in Canada, she has done an amazing job to bring Black issues and recognition to the forefront. So we're very pleased to have Ms. Rosemary Sadler also on this call today. We have also Dr. Oyedeji Ayorinde from Queen's University. Dr. Madeline, I'm not sure if you remember him at the 2018 conference. He was one of our presenters. And even though his area of expertise is mental health, he has so much interest in sickle cell, also having lost some loved ones to this disease. So we want to, just thank you all and welcome you. I believe there is also Dr. John Way, who worked closely with Ms. Jenny Gomes at the Sickle Cell Disease Association of Canada. So thank you for having, all the major movers and shakers in Canada also on this call today. So we move forward to introduce our next speaker. That is Mr. Riyad Elbert from Thalassemia Foundation of Canada. I am one person that strongly believes in the benefits of cross-disease collaboration. And I believe that our work with the Thalassemia Foundation and also even with the Hemophilia Society has also helped us in the sickle cell community to move things forward. So again, I will like to pause my long talk and introduce Mr. Riyad Elbert, President of the Thalassemia Foundation of Canada. Thank you.
Thank you, Lanre, and thank you everyone who helped organize this meeting. I truly appreciate the invitation. And first of all, thank you to Senator Jane Corby and to MPP Gazzetto and MPP Kangen for all their support. And it's that genuine support that really helps us to move forward. Let me try and see if I can share my screen here. Okay, so thank you. I do want to talk about how it is important to work together and how there is strength in unity. So first of all, I want to introduce our organization briefly, Thalassemia Foundation of Canada, which started as a patient and parent support group back in the 1980s, and then has grown to become a national organization helping thalassemia patients across Canada. Our mission is to support and fund thalassemia scientific research, treatment, patient services, public awareness, and education. We have 13 board members, plus support from regional representatives and 200 board members, medical advisory board, and other volunteers. We're 100% volunteers. There's no paid staff. We're an independent organization. We receive very little donations from industry. So what we try to do is provide patients with accurate and current information on thalassemia and research and treatment, and help patients navigate through the healthcare system while providing beneficial resources and supports to thalassemia. And also one of our biggest goals is to fund research, and we do on average about 2 fellowship research grants per year in the amount of $40,000 each grant or so about $80,000 every year for research. So the early days of thalassemia, as many of you might know, the survival was very, very low rate. So thalassemia patients did not pass their second decade of life, and that was because the treatment was very limited. Deferoxamine, which is known as brand name Desferal, is a subcutaneous iron chelation, which was actually a stroke of luck that we were able to use that, which was actually designed for treating people who work in mining and have a high metal concentration in their bodies. So parents of thalassemia patients had to petition and to lobby to have this treatment accessible to our patients, and they did that back in the late 70s, and then it got listed under the Catastrophic Drug Program in Ontario. And then I must mention the great work and support from Dr. Melvin Friedman at the Hospital for Sick Children, who approached parents of thalassemia patients to form the association, and we started doing that in the early 80s. Now, the need for advocacy was much later, because in the 80s and early 90s, these were the golden years. So for living, if you have thalassemia patients living in the GTA and near cities, you have no problem. You have everything happening. We had very great standards of care back then. Now, access to blood with the was the major factor for advocacy and collaboration among patients with life dependency on blood. So we started to collaborate with the hemophilia and myelodysplasias groups, and that's when we went through the restructuring of the Canadian blood system. And there were some people who were asking for hepatitis C compensation, and that included thalassemia. So this is why we started, is because of the the harm that many of our patients received through the tainted blood. So drug research controversy also in the I would say late 90s was a huge challenge and impacted our patients hugely, and it was a major devastation. And still, to much later recent points, it still divides the community. There's still a lot of politics on that is really terrible, and it really has a very negative effect on thalassemia care. So access to new medication and technologies, that's why we need to advocate for that. And that's when we started to say, okay, we need to know more about how we can access drugs, how we can access new drugs, what is the process. And at the same time, that was like in the late 90s, there was budget restriction, and the hospital administration at UHN placed a cap on the number of transfused patients at the only adult clinic for hemoglobinopathy patients. And that was a dire situation. So the goals we wanted to do is establish comprehensive care for thalassemia and standardize the care across Canada, access to new and innovative drug treatments and medical assessment technologies such as T2 Star and Ferriscan. So we collaborate with experts and centers at hospitals to provide that there is very good care for thalassemia patients. Again, blood safety and adequacy is an important goal for us. Patients' rights are protected. We want to make sure that we have rights and we're treated fairly, and empower and support patients on self-advocacy. Just quickly, there's about 1,200 patients with thalassemia in Canada, and that's the various forms of thalassemia. About 600, maybe a little bit more, is beta thalassemia major, which is the dependency on blood transfusion. And we've made some progress over the years. We developed our guidelines back in 2009, and that was based on the TIF guidelines and the UKTS standards of care. And the purpose of those was to develop an education tool as well as an advocacy tool so we can ask for the optimal treatment that would be available. At the same time, the approval for a new testing, the MRI and the treatment that's coming about has improved the life for thalassemia. We had the new drugs come out on the market, XJID being the first oral chelation therapy, and then a few other medications that came about. And then the establishment of the care program at UHN encouraged other clinics and centers to start. So we had to start with the hemoglobinopathies program at Toronto, and the idea was to actually move forward by having other centers, but unfortunately nothing happened after that till much later. And CanHEM in 2013 was formed, and they have done the consensus statements of clinical guidelines of patients with thalassemia in Canada, and that is basically a revision of the Canadian guidelines for thalassemia. So we need resources. As you know, we have 12 clinics across the country, and a lot of them still lack the necessary resources, such as social work, nursing support, and many other resources. So research and clinical trials are only done in Toronto, so we need to have access to research at other centers, and patients are being denied that because there's not resources for research in the other centers across Canada. And we also need to do some more training, so we need more resources for that at the centers that treat thalassemia, and some of the academic institutions, they really need that support to do more training, both for thalassemia and sickle cell, medical professionals. So, and immigration trends are increasing in Canada, and the trends has been that people coming from India, the Far East, Middle East, and many other countries that have prevalence of thalassemia and sickle cell. So the numbers will continue to grow, and access to new treatment innovation therapies is a long process in Canada. And we hope that the policies will help us to remove many of these barriers and the cumbersome process. So we're hoping that with their rare disease drug strategy will help us move forward. So the current situation, I see it presents both challenges and opportunities. Now, we joined efforts on common goals to have a strong voice, to increase resources, learn from sharing experiences and successes, grouping together, sometimes not by choice, but you are grouped together by the governments and the clinics, guide, and we work together to support and guide one another, engage with other stakeholders to reach solutions. Forming relevant partnerships is very favorable and is received well by all stakeholders. We partner with many organizations: Thalassemia International Federation, Canadian Blood Services, Canadian Organization for Rare Disorders, Network for Rare Blood Disorder Organizations, and Canadian Hemoglobinopathy Associations, and of course our natural and brother and sister organizations, our sickle cell disease community. So the reasons for the collaboration would be that both conditions are hemoglobin disorders. We share clinics and hospital resources. We are managed under the same hematologist research and clinic teams. We would benefit from awareness, screening, and prevention programs, which could target both. Predominantly affects new immigrant and underprivileged communities. Dependency on expert blood bank, transfusion medicine, and emergency department services. These are all common to both conditions. So again, strength in number and efficient use of resources. When you pool resources and collaborate together, that helps small charity organizations, which many of us are, the Thalassemia Foundation and the many groups within the thalassemia, within the sickle cell community. And it is to present clever, comprehensive business case to the health authorities and hospitals. It would be really smart to come together rather than going as thalassemia and then going as sickle cell and then going as a different group. It's really does not receive the attention, and you're leaving something out, so it's incomplete, and a lot of the time might not even, it will be dismissed. So both diseases are listed as hemoglobin disorders and are thought of as one group by health authorities, hospitals, and doctors. So we need to get used to that, because this is how it is. We're in it together, as has been mentioned, and we've seen that many centers or many countries, they are linked together as one group and as one organization, because of the number of the patients is very small to have one for each. The highlights of the activities we've done, we've worked together very collaboratively and successfully over the last 20 plus years. So we started the Joint Advocacy for Adult Care Clinic program to serve adult patients in the Toronto area. And that was a long battle. And as mentioned by Senator Cordy, that it's a marathon, it's not a sprint run. And we really learned that lesson. We had to go back between Ministry of Health and hospital and other, district health council at that time. It was really a very good learning lesson and experience. So we did joint education events between 2001 and 2007 that were coordinated by Anemia Institute for Research and Education and included other patient organization groups such as Fanconi anemia and myelodysplastic anemia and other rare blood disorders. So the sickle cell newborn screening, which was done by the sickle cell community, and I put stars here because we supported it. It wasn't something that we did a lot of work on, but we were supporting of it. We understand that it is important to have, and that's why collaboration is important, because sometimes you would want to support the cause of the other group, even though it does not benefit you directly. And advocating for access to new therapies in Ontario and other provinces, we started doing that in 2007 with the new oral chelator at that time, which was Xjade. And we went to the Ministry of Health, and we didn't go as thalassemia or as sickle cell. We went together as all those who are chronically transfused patients. And then the strategy was to go no separate diseases at a time. But again, you always try to go together, and then if you can't, you will try and work around that. And advocacy for sickle cell and thalassemia care in Ontario, that's when we started to collaborate with Landry, and we started back in 2010 to about 2018. And this makes me want to appreciate, to say that we truly appreciate MPP Kangin and MPP Cozzetto, because we meet a lot of politicians. I've done a lot of advocacy through the Canadian Organization for Rare Disorders and for thalassemia and sickle cell. You get a lot of support, but you get a lot of people who just do lip service. And at the end of the day, it's very few that genuinely support you and move forward. And I do want to thank MPP Kangin, MPP Cozzetto, and Senator Cordy for really championing these causes. We initiated working group of representatives from both patient communities. We started that in 2006, and we have with us hemoglobinopathy expert, the hematologist from clinics in Ontario. We started that back in 2016, and we're doing great work with that. We are trying to find solutions for the clinics and to improve patient care and patient outcomes. Advocating the Ontario Ministry of Health, which Landry has been really the lead on this, and I've been working with her on that. So we are trying to find resources for 5 Ontario clinics that we identified as in desperate need for some resources. Again, Bill 255, Sickle Cell Awareness Day and Thalassemia Awareness Day. Awesome. This is a great success story. And thank you to all who supported us on this. The last thing I want to say is now it's time to think of our next steps, and I think it's time to seize the momentum and expand efforts beyond Ontario. And I think we're starting to do that in Nova Scotia and the Maritime region, so we can have an adult care clinic there for patients with hemoglobinopathies, and that is a serious concern right now. Last thing, I want to remind you of all those patients who are struggling with thalassemia and sickle cell, that sometimes the strongest among us are the ones who smile through silent pain, cry behind closed doors, and fight battles nobody knows about. Thank you very much.
Thank you very much, Riyadh. Words are very comprehensive and detailed presentation, and that really shows your level of experience doing this over the years. And thank you for the collaboration opportunities with Thalassemia Foundation of Canada. And talking about the last statement you made, that we're looking to work outside of Ontario, it gives me much pleasure to introduce Ms. Cynthia Musonda, who is the president and founder of the Sickle Cell Awareness Network of Saskatchewan, a province in Canada. And I think, it would be great for you to also connect with her and see what work can be done in Saskatchewan. So, Ms. Cynthia Musonda, thank you.
Wow. Good morning, good evening, good afternoon, everybody. How great has this been and how inspiring has it been? So I know Ms. Lanre has said that I am the founder and president of the Sickle Cell Awareness Network in Saskatchewan, but I'm also a parent of a 17-year-old boy with sickle cell. So I am speaking as a parent as well as an advocate who has an opportunity to see how this scourge has affected people at different levels. As you would know, people are affected at different levels and different intensities. So I have brought that up so that I can just let everyone who is on this call to realize that this is not cliche, but this is something that is being done to touch real people who exist and people who are very appreciative of the efforts that were there. We are immigrants to Canada, and I am so grateful to see the progression of the work that is being done, that every year we are hitting different strides, to make sure that our patients, our families, are getting better care every day. I think I thought I should put that out to everyone on this call, because when you have a child with sickle cell, it doesn't start and end in a conference like this. It's an everyday thing that you have when you're having breakfast, when on your tea break at work, when you're planning your holiday. So it's a real reality of really trying to make and to bring normalcy to life. And having said that, I'll just encourage the other participants whose videos are off at this point, if you could turn it on. And that is really just as a gesture of respect to each one and to each and every one of you, and our sponsors that have just been able to put this together. So I know I've gone a little bit off script here, but I just felt that it was really important, because sometimes we get wound up in saying things that, we prep for so much, but, the gravity of the impact of what is being done here is so great. So thank you. I'll go back to it. And I just want to say thank you to Chicago. I want to say thank you to Ms. Lanre and the entire team, your board and your management team, for putting this conference together, to give us a perspective of what is happening elsewhere, just to be appreciative to because sometimes when you go through something like this, you tend to wonder to say, but our friends are so behind. So when you hear stories coming from India, from Europe, it brings much encouragement to realize that something is really being done. I want to thank our politicians, Senator Cody, and MPP Rudy, for just being there for us, championing the cause for us at at that level. So going back to our sponsors, I want to thank Novartis, and I want to thank Pfizer. I want to thank the Global Therapeutics as well for just being able to facilitate sponsorship for events such as this. And as you see those requests for sponsorships, please put some faces to those requests. Think about that person in Saskatchewan. You know, when we came here, my kids called it Saskabush. So it's interesting when we have to hear that we have people who speak for us. So when you see those requests coming for our blood disorders, please don't shove them under. There are real people who are affected by this. Thank you so much for what you do for our community. We really appreciate it, and we wish you all well in this pandemic, and even in your ventures with the organizations that you pioneer. Thank you.
Thank you, Ms. Cynthia. You did go off script, but it's great that you're speaking from your heart, and that is very important. So thank you so much. I think Ms. Cynthia is requesting for everyone on the panel to put their video up. She would like us to have a picture. So if we can do that, I believe we have Dr. Marimilia Peter and Dr. Hat. Yes, thank you. And our technical guy would take our picture. And Dapo, when you're done, please let us know.
Can you hear me?
Yes, we can hear you, Dr. Peter.
Okay. Well, first of all, I would like to thank Chicago, especially Mrs. Landry.
Dr. Peter, you are not speaking yet. Sorry.
Oh, yeah.
Not yet. Almost. We are almost there. Thank you.
Okay.
I think the picture taking is done. I got the message. Thank you, everyone. We move to Dr. Behovsek, who will introduce the next speaker. Thank you.
Yes. Next, Dr. Pita, there are two more people before you. Thank you for your patience, but also just a testament to the incredible lineup of people we have here with us, for which we are so grateful. So next up, I have Dr. Emily Meyer, who is a pediatric hematologist and director of sickle cell research at the Indiana Hemophilia and Thrombosis Center. She is the vice chair of the American Society of Hematology's Committee on Government Affairs, the co-chair of the Scientific Executive Committee of the Sickle Cell Transplant Advocacy and Research Alliance, and a member of the executive board of the Indiana chapter of the American Academy of Pediatrics. She has authored and co-authored more than 50 articles and 5 book chapters. She develops and leads programs to improve access to care for children with sickle cell disease throughout Indiana. We're so grateful to have you here with us, Dr. Meyer, and we welcome you.
Thank you. Thank you very much, Madeline and Ms. Lonray, for the invitation. And I'd like to thank ASH for allowing me to speak on their behalf. So I'm going to cover today a portion of ASH's sickle cell initiatives. And ASH is the American Society of Hematology, and it is committed to addressing the burden of sickle cell disease in the United States and globally. And the society has taken and continues to pursue a multifaceted approach to improve sickle cell advocacy, research, and access to high quality care. And ASH also founded the Sickle Cell Disease Coalition in 2016 to enhance collaboration with stakeholders and amplify the sickle cell community's voice. And I know many of the organizations represented here today are part of that coalition. As you can see from this slide, ASH's Sickle Cell Initiative is really multifaceted. It actively works to ensure all aspects of the initiative are patient-centered and continues to partner with key stakeholders to foster coordination and avoid duplication of efforts. And in our brief time together today, I'm just going to update you on ASH's domestic and global sickle cell advocacy efforts. So advocacy, as I've said before, is a major focus of ASH's Sickle Cell Initiative. ASH works very closely with federal agencies and the United States Congress to help enhance and expand government activities in sickle cell research, training, and services. ASH works with congressional champions to raise awareness for sickle cell disease on Capitol Hill in Washington, D.C., and to increase funding for federal sickle cell programs, which is very important because in the United States, that's the main source of funding for research initiatives to help improve the lives of individuals affected by sickle cell disease. Additionally, ASH continues to take important steps to improve reimbursement for sickle cell care and treatment. Unfortunately, we have many different payers in the US, and so it's always important to educate everyone about the need for adequate reimbursement for care. Many may be aware that in 2020, the National Academies of Science, Engineering, and Medicine released a guideline and report on the state of sickle cell in the United States. And in October of 2020, ASH virtually held a briefing that highlighted the key recommendations in that report and the potential policy solutions to address the items that were identified as deficiencies. Specific things that ASH is doing federally is advocating for the funding of the Centers for Disease Control Data Collection Program. And while many of our other speakers have been able to say how many people are living in their country or their region with sickle cell disease, in the United States, we are only able to offer estimates because we don't have a surveillance program for sickle cell. So that's what the CDC is aiming to do. And we got great news just a week or two ago that $2 million in funding was included in President Biden's budget, which is the first time that congressionally appropriated funding for this program ever appeared in the budget, which is a huge victory for ASH advocacy efforts, because this is one of the things that the Committee on Government Affairs has been talking to our elected officials about over the last 3 to 4 years in our visits to Capitol Hill. ASH also advocates for funding of sickle cell programs through the Health Research and Services Administration, or HRSA. And HRSA is a federal agency that within the U.S. Department of Health and Human Services that's focused on improving access to healthcare services for people who are uninsured, isolated, or medically vulnerable, which many of our patients with sickle cell fit into at least one of those categories. And ASH also works with members of Congress on legislation to direct the Centers for Medicare and Medicaid Services to develop a demonstration program under Medicaid, which would be focused on improving comprehensive outpatient preventive care, as well as primary care for individuals with sickle cell disease. And just for those who may not be familiar, Medicare and Medicaid are the two government-funded health insurance programs in the United States. Unfortunately, it doesn't cover everyone, but it does cover a fair number of people with sickle cell disease. I'm going to switch now to ASH's global advocacy efforts for sickle cell. And one of the major components of that is the Consortium on Newborn Screening in Africa, or CONSA. As everyone knows, over 300,000 babies are born annually with sickle cell in sub-Saharan Africa, and the majority don't live past their 5th birthday because of the lack of early identification and supportive care. And so ASH launched CONSA and invested resources to demonstrate the benefits of laboratory-based newborn screening and early intervention services for sickle cell in 7 African countries that are listed here on the screen. And as of this week, 5 of those 7 countries have launched their screening sites. Liberia and Kenya are still waiting to launch, but the other 5 countries launched. And through this effort, ASH aims to screen between 10 and 16,000 babies annually in each country, and then provide access to clinical protocols that will provide penicillin prophylaxis, vaccines, education for families, as well as malaria prophylaxis and prevention for these infants who are enrolled. And then there will be some clinical data collection into a registry for further research and analysis. And hopefully the plans for CONSA are, as they demonstrate the benefits of newborn screening, then ASH will simultaneously work with local governments and hopefully get their buy-in, so that then the government can take over this initiative and scale it up and continue to expand the programs. So stakeholder engagement is key to the sustainability of the CONSA activities. And as you can see from these photos, senior members of ministries of health for the 5 countries who have already launched the screening sites have been involved in the launch. The top left are members in Zambia who were involved. The top right are Ugandan Minister of Health representation, and then the bottom is Nigerian Ministries of Health. And national experts are also working with ministries of health to develop national strategies and guidelines in order to provide general information to the population on the importance of screening and care for people with sickle cell disease. And at a strategic global level, ASH is working with key stakeholders to share subject matter expertise and improve external partners' sickle cell efforts. Most recently, ASH has offered guidance to the World Bank to strengthen sickle cell response in Africa. And this includes participation from US health agencies, United Nations partners, and industry. And ASH is pleased to serve as a key expert within this coalition. So in summary, I just wanted to share some of the lessons learned, and they're very similar to what's been shared by the other speakers today. You need to educate people about sickle cell disease. As I think Ms. Laura mentioned, many physicians who are medically trained don't know about sickle cell, and so it's hard to expect legislators and elected officials to know about it. And so providing education, especially that patient voice and the patient perspective, because the patient stories are always so compelling and important for those policymakers to hear. Relationship building is key, and I've seen that in my work through the Government Affairs Committee at ASH, and that you need to expand networks, continue to bring people in and collaborate so that you can join voices and join forces to really make impacts in care that are long lasting. And then, as I mentioned earlier, the voice of the community is critical, really hearing from those people who live with the disease day in and day out, and hearing all of the struggles that they face and what the key issues are to address. And then patience, which is probably the hardest thing for me, but it does take time. It's not a fast fix, but continuing to educate and continuing to be there and show up on Capitol Hill and talk with your legislators is very important. And so I've touched just briefly on some of the American Society of Hematology's efforts with sickle cell disease. The website is here if you'd like to learn more, and I'm happy to take any questions as time allows. So thank you again for the opportunity.
Thank you so much, Dr. Meyer, for taking us on a whirlwind tour of all that ASH has been doing and that you have been partnering in this important work, both in the United States and globally. So thank you. Next, I would like to welcome Dr. Adekunle Adekile, who is a professor of pediatric hematology in Kuwait University and head of the hematology unit at Mubarak Al-Kabir Hospital in Kuwait. He is also an adjunct professor in the Center of Excellence for Sickle Cell Disease Research and Training at the University of Abuja, Nigeria, and the chairman of the Sickle Cell Support Society of Nigeria. He has published over 150 articles in peer-reviewed journals, and we are delighted to have him here with us to speak with us today. So welcome, Dr. Adekile.
Well, let me start by thanking Larry and the organizers for inviting me to be part of this webinar. It's really a pleasure and honor to share the panel with such distinguished individuals. And it's very inspiring to see the MPs who have shown so much commitment and interest in sickle cell disease. It's very inspiring. Thank you so much. So I'm going to be talking about, what we're doing in Nigeria and what are the peculiar problems associated with advocating for sickle cell disease in sub-Saharan Africa. Judging from the nature of this panel, it's obvious that sickle cell disease has become a global disease. However, the strategies for the control and advocacy have to take into consideration the realities of what obtains in each locality. As we know, the epicenter of sickle cell disease is in sub-Saharan Africa, and Nigeria bears the biggest burden of the disease. It's very overwhelming. However, when you look at the distribution of wealth in the world, as shown by this stock market world capitalization, you see that sub-Saharan Africa, or the whole of Africa, virtually disappears. Therefore, we know that this part of the world suffers from poor resources and availability of infrastructure. Therefore, there are peculiar challenges that face anybody who is looking after sickle cell disease patients in sub-Saharan Africa. And some of the challenges include the lack of awareness. The knowledge of sickle cell disease is very poor in the society in general, even including among healthcare workers. Several studies have been done in Nigeria and Ghana that show that there's so much confusion about what sickle cell disease is among community health workers, among nurses, and to some extent even among doctors. So that's a big problem. And stigma is huge. It's a social stigma to be labeled with sickle cell disease. And for this reason, many people don't even want to come forward. They hide the diagnosis. And there have been stories of eminent people in the society, including ministers of health in some places, who have children with sickle cell disease, but they would not disclose it. Now, the majority of patients, therefore, are left undiagnosed or diagnosed late, which creates its own big problems. Most patients live in the rural areas with poor access to healthcare. And even when you set up a clinic in a secondary or tertiary healthcare center, in no time at all, you become inundated with numbers. So many patients show up, and many of the individual clinics in our centers in Nigeria would be catering to thousands and thousands of patients with very limited number of personnel to take care of them. In addition to this, there's poor infrastructure. Electrical power is not usually reliable. There's lack of equipment to make diagnosis and for treatment and other uses. And the facilities and staff, as I've said, are limited. Now, if you want to concentrate a little more on Nigeria, it's a big country. It's one of the largest countries in Africa and certainly the most populous, with a population of over 200 million. And the prevalence of sickle cell at birth is up to 2%. So 2 of every 100 children or babies born are affected by the disease. Now, there are 36 states and 174 local government areas. However, for geopolitical reasons, it can be easily divided into 6 geopolitical zones. And okay, now, we've listened to several presentations now, so we know that some of the issues of advocacy in sickle cell disease are universal, okay? But some of them are even more prominent in sub-Saharan Africa. And what I've called the pillars of advocacy include, a multidisciplinary team or multidisciplinary approach. However, because of the complexity of the disease and the genetics and clinical presentations and treatment, it's usually advisable to have a health professional involved with each group so that we can direct and educate at the right moments. But however, if you want to go into the grassroots and to be effective, you've got to go through the traditional rulers, chiefs and elders in the society or in the community. Then the religious and other community leaders have to be involved. And certainly patients and patient support groups are very important. And then the media, you have to engage the media, print, radio, television. And these days there's so much effect, so much activity on social media. And each country now has their own local celebrities, either movie stars, sportsmen, and women, and the so-called influencers, I hate that term. These are people that could also be part of the advocacy team. Now, you will notice that I've put government last, not because government is not important, but as we've heard, things move very slowly, and it's a multiple marathon, if you want to think of it that way. So now, but all these other stakeholders have to put pressure or lobby government, and so that we can get a direction or policies at that level. However, the governments in sub-Saharan Africa have to deal with so many issues. So there are so many competing diseases and other social problems. And therefore, sickle cell disease tends to be pushed to the background, but we have to persist. Now, because of all these reasons, the Sickle Cell Support Society was established about the year 2010, like 2 decades ago, as a network, bringing sickle cell disease stakeholders both within the country and in the diaspora, including physicians, scientists, social workers, NGOs, and patients. Okay, now we now have multiple collaborating centers spread all over the country. There's a central executive committee that directs the affairs and liaises with the Federal Ministry of Health, coordinates research activities, and organizes biannual conferences. But we have one representative in each of the 6 geopolitical zones that coordinates regular awareness drives, screening and counseling, educational programs, and liaises with the state and local governments and the local community leaders and groups. Unfortunately, we still do not have a national policy on sickle cell disease. However, sickle cell disease is now part of the policy for non-communicable disease in the country. Okay. Now, but some of the state governments are going more proactive, and they have some form of policy for sickle cell disease. One of such states is Abia State, which recently passed legislation that all individuals in the state must have their hemoglobin genotype determined, and this must be part of their identification card. In addition, the sickle cell is now part of the school curriculum. Newborn screening is probably the most consequential intervention in sickle cell disease advocacy, which identifies affected patients early and enrollment in comprehensive clinics. So the strategies adopted in resource-rich countries would not work in sub-Saharan Africa. HPLCs, IEF, and all those, you cannot really operate for several reasons: poor electrical power, it's expensive, and there is lack of trained personnel. More and more, we are utilizing point-of-care testing kits, which do not require power supply, which anybody can use them. And we have some publications on that. Moreover, we are also using established programs like immunization programs, to get patients to screen at that level. As Dr. Maya has mentioned, we are part of CONSA, and that which is supported or initiated by ASH, and the program is going very well in Nigeria, and very soon they will hit the target recruitment numbers. Community care is so important because it's a truly public health problem. Most patients are seen in the rural areas. Community health workers have to be trained to diagnose, counsel, and provide basic care and administer routine drugs. And they should be able to identify patients that need referral to hospital. Okay. So we are working in this space to train community health workers as much as possible. This is one of our events where community health workers who are in training were being trained on sickle cell disease with some of their teachers. In conclusion, advocacy in sub-Saharan Africa has to be adaptive. You have to involve all stakeholders, including patients and patient support groups. Government should be, brought in. And there are several things that the government can do in terms of providing policy and taking care of the health insurance for patients in need. And the key priority areas are awareness, newborn screening, and community care. These are some of the events organized by this society in different parts of the country to mark the current Sickle Cell Day. So thank you so much for your attention.
Thank you very much, Dr. Adekile. Certainly, Nigeria is the epicenter when we think about sickle cell disease around the world, and in terms of where, in many ways, the need is so great. So thank you for providing all of that overview of the work that is happening and that continues to need to grow. We'll now come to Dr. Marimelia Pita. She is a pediatric oncohematologist at Hospital Samaritano and in Sao Paulo, Brazil. She's a member of the pediatric department and the medical students program at Laureate University. She is founder and president of the Pediatric Committee of the Brazilian Society of Hematology and Hemotherapy, president and executive officer of the Lua Vermelha Sickle Cell Disease Association, board member, Global Alliance of Sickle Cell Disease Organizations, and co-chair of the Scientific Committee of GASCO. So we thank her so much, and she has the unique role of being the last of this very eminent panel of speakers. While I think she had mentioned she was calling us from the hospital, so she's a busy lady who has created time in her schedule for us today. Thank you, Dr. Pita. You'll just need to unmute, Dr. Pita.
Can you hear me? Yeah. Well, first of all, I'd like to thank Cabo and especially Mrs. Larry for inviting me to this event that surely will raise attention about sickle cell disease among healthcare professionals, patients, caregivers, and the general population. As you all know, sickle cell disease is one of the biggest healthcare challenges around the world, based on data from the World Health Organization and UNESCO, and it's not different at all here in South Africa. In fact, I'm here today to tell you how we started an advocacy program in a country like Brazil, with continental dimensions, developing economy, very diverse population, very diverse culture, highly miscegenated, and now totally devastated after coronavirus pandemic. To face this challenge, we created the Red Moon Association, Lua Vermelha in Portuguese, Dr. Madeline. In Brazil, we have about 3,500 sickle cell newborn cases per year, and the highest incidence is in the northeast part of the country, the poorest part. Being a pediatric hematologist, I'm used to go every day into the pediatric hematology ward and hearing the intense crying of children, especially those with sickle cell disease. In fact, the most uncomfortable situation for me was to be aware that parents which arrived with the children in our hospital from many different regions of the country knew nothing about the disease. And in most occasions, they had wrong concepts about how to deal with it. This situation was even worse by the fact that our general doctors aren't well prepared to take care of sickle cell disease patients. In this complex panorama, the only thing I believed was the best way out of this situation would be an awareness and education program, which would be the start of my own most difficult challenge. In Brazil, we already have about 40 sickle cell disease organizations linked in one national organization. But however, all of them are basically involved in getting medications, transportation, food, and so on. We all know the patients need this kind of help, but I believe the most important tool for them is to know everything about their disease, since it will bring credibility and security for them, especially in emergency situations in which clear information can help the doctor's actions. That's why Red Moon, an organization, was created to provide good quality technical information to patients, caregivers, and the general population. We understand that the result of this action brings education to all of the society, and it's the start of patient social inclusion and improvement in quality of their lives. In the very early beginning, to start the relationship with patients and healthcare professionals, Red Moon created a digital campaign to bring awareness to sickle cell disease. Since we understood that digital social media would be the fastest and easiest way to reach sickle cell disease patients, family, healthcare providers, and general population. To call attention, we also invited a TV celebrity, and I think it helped a lot at that time, since the campaign was a real success. Throughout the year, we have lots of activities, especially the education ones, webinars, and all the patients have access to participate in Brazilian Hematology Association, congresses, and Brazilian Bone Marrow Transplantation Society Congress. After this first step, now that Red Moon already has its own space, nowadays our most important goal is to complete the Brazilian Sickle Cell Disease National Registry, since we understand that it will bring us the Brazilian sickle cell disease patient profile, and it will be easier to support these patients. Finally, I'd like to say that I really believe that only when the general population is aware of a disease which is called sickle cell disease, our patients will have a better quality of life, since they will be included in all their social lives. I thank you very much, and that was I had to tell you. Thank you.
Wow, thank you so much for joining us and for sharing all the work that you're doing, and that the many other organizations there are doing to improve the care of people with sickle cell disease in Brazil. So, Ms. Lanre, we have a few moments here now to field some questions from the audience. There have been some questions coming through on the Q&A, and many lovely comments coming through as well on the chat. Maybe while I have the microphone, I will read out the first question, and this one seems to be addressed to MPP Cusetto, if he may. So this is Olu Abatan is asking, thank you to MPP speaking, and I think this may have in fact been directed to Ms. Kanjan. This person asking the question says that in Ontario, our doctors understand our need for pain relief, but challenges are more with pharmacy. Issues being called a drug addict when trying to pick up a prescription for pain medication. Any thoughts on how this can be addressed? And they also mentioned that this was with a well-known pharmacy.
Yeah, there's still a stigma on that, and we have to work together with our Minister of Health to get rid of the stigma of people thinking that you are drug addicts because you need pain relief for this disease. So I think it's more that we have to work together with the ministry and try to remove that stigma. And it's more even just awareness. I think if we get more awareness out there, people will understand the real issues. And I apologize for the noise in the background.
I didn't even notice. Thank you very much for your response. Ms. Lanre, did you want to take the questions from here?
Well, I agree with MPP Cocheto that there's still a lot of work that needs to be done in terms of improving knowledge around sickle cell disease among care providers, but also, with the different pharmacies as well. So, and as Senator Cody said, it's not a sprint; it's a marathon. We are doing it. We are working with the Ministry of Health, to see how we can roll out, effective and accountability when it comes to, our care providers, and also, which we include those who are providing services, right, as the pharmacists. So, Yemisi, we are working hard on this, and thank you for bringing that question up. I also noticed in the chat, one parent put in the chat that she's using this opportunity to appreciate all that puts this session together. She mentioned that she has only one daughter that's really going through a lot by sickle cell disease, and she almost lost her last month. As she's speaking, our daughter is going through crisis. It's really very difficult to access doctor, someone you can call and get immediate attention. I really don't know what to do. I need an advice. My daughter is going through hell. I'm wondering if, I'm thinking any of the doctors can maybe answer this question. I believe this individual is from Ontario, so I'm wondering if maybe Dr. Madeline can actually answer this individual.
So it sounds like there's a lot of challenges here, and perhaps accessing a doctor is one of the most the most pressing. In general, I guess it would depend a bit on whether this is a pediatric age group daughter or adult. But what I can say is that depending on what region you're in, there are clinics that serve all of the major regions for outpatient care. So number one is being connected in with getting her connected in with a physician who can look after her overall care and do a lot of the preventative, make sure that she's on all the right treatments to keep her well. And then there's the problem that I'm hearing coming through there as well is that challenge and almost losing her last month, going through a crisis. So this is something that in that moment, being there with your daughter, speaking up for her, making sure that you're advocating for her, which it sounds like you're doing very strongly. On a higher level, it's some of those things like MPP Cuzetto was saying and Ms. Lanre, as provincially, us needing to raise awareness, raise the standard of care across our emergency departments, and raise the awareness among the different hospitals so that all the resources are in place. And that's something that feels very urgent and is very urgent. And on World Sickle Cell Day really brings this front of mind and where we need to focus our efforts.
Thank you, Dr. Madeline. And I also want to add that one of the things that we need to also remind ourselves is that I find sometimes that individuals with sickle cell disease do not have family physicians. And referral to comprehensive care is through your family doctor. So I'm also encouraging everyone to make sure that don't have that connection to the hospital through the emergency department. It's important to have a family physician that will refer you to comprehensive care so you can be monitored there. The more you receive comprehensive care, the less opportunity you'll have to be ending up in emergency department. So Again, it's a lot of work that still needs to be done, and we will keep on working on that. I'll take one more question here. What do you feel needs to change, especially during the current pandemic times, to lower deaths and losses due to sickle cell disease? So what do you think needs to change? Any of the panelists can take this question for us. Thank you. I don't want to put anyone on the spot, but this individual wants to know what needs to change or what needs to be done to reduce number of deaths and sickle cell losses during the pandemic. What can we do?
I think I can give my opinion if you would like. So I think, I think the pandemic, at least in the United States, highlighted a lot of disparities of care. And many of them in the US are racially based. Access to care, similar to what the previous participant asked about, and making sure that all patients have access to a sickle cell expert. And in the US, at least, increasing education in medical schools about sickle cell disease. When I was in medical school, I can remember on my pediatric hematology oncology rotation, there was one patient admitted with acute chest syndrome. And they almost wanted to make that patient case a grand rounds, like present it to the whole hospital, because it was so rare in Indiana. I went to medical school in Indiana. And I think that should not be the case. I think that physicians need to know about sickle cell disease. As you mentioned very early on in this conference, it's the most commonly identified disorder on the newborn screen. Doctors should know about it regardless of what their specialties are. So I think those are two things that could be done to minimize some of the disparities.
Can I just add that there are also some issues from the patient side? Now, because of the pandemic, many patients are a little hesitant to go to the hospital because, you see, they're afraid of catching COVID, okay? Unfortunately, these are the patients who really need to be seen quickly if they're going to crisis or if they're having any other acute events. So what I would advise is that as much as possible, patients should have a personal relationship with their caregivers, so that at this period, even if you can't go to the hospital as usual, if you run into any problems, you need to be seen as soon as possible, okay? And please, there are some patients who are also questioning the use of vaccines, that maybe it's going to give them some other adverse effects. We have to encourage patients as much as possible to get vaccinated and follow all the other social distancing advice as much as possible. Because as we are beginning to see, sickle cell patients are prone to some of the even bad complications of COVID when they get it.
Thank you so much, Dr. Hadi Kile. Before I pass it back to Dr. Verhofsek, I want to quickly recognize that Mr. Gautam Dongri from India, whose video we listened to a while ago, is finally able to join us in person. He's been in 3 or more conferences today, speaking all over the place. So welcome, Mr. Dongri.
Good evening, everyone. Thank you so much, Ms. Landry, that having me here. So I apologize that I couldn't join your full session, and I really missed that beautiful session. And so please provide after that some link that I can watch all the session. And thank you so much to everyone that you have listened. India Voice, the patient of India, which is more having troubles for sickle cell disease patients. They are waiting for the global help also. We need to eradicate sickle cell disease to come together. So that's all. I would like to thank Landry that you have given the chance to the India sickle cell patient for giving their opinion here. Thank you so much, Navin. Thank you all.
Thank you. Dr. Behovsik.
Thank you very much. So I think we have maybe about 5 more minutes left for these questions. I noticed that Ms. Cynthia has her hand up, but I'm not sure if that was something that you already had a chance to share or if you would like to share with us.
I actually have a question around stigma because I think it's been synonymous amongst the speakers that have been speaking. And we've talked, I think we've had pockets of addressing stigma, as a part of our strategic goals. Has there actually been a deliberate research to find out what this stigma is about and if it's consistent, because we have a global platform here. Is it consistent around the different parts of the world? Because I am failing to understand stigma as opposed to empathy, because this is something that people are not completely in control over. So where exactly is the stigma coming from, and is it seemingly uniform across the globe? Thank you.
Thank you, Ms. Cynthia. And so, as you ask about research, I'm going to turn to our 2 physicians who are still here with us on the panel, Dr. Meyer and Dr. Adekile, to comment on that. Where are we at with research in stigma? And is it different in different parts of the globe, or is this something that's universal? And how do we address this?
Well, if I may start, stigma is a big issue, and especially in Africa, because traditionally people do not know the cause of the disease, and they see it run in some families. Okay, so it's not just the patient that is stigmatized; whole families are stigmatized. Okay, and with serious social implications. Okay. Secondly, they think there's some evil spirit involved. Okay, and some patients and some kids are born to die, and there are cultural things associated with that. Okay, and when a family is labeled as having a genetic disease that can be transmitted, then they are avoided in the society. So in terms of marriage, relationships, so that's what this kind of stigma is inbuilt. All right. And then, of course, as the patients grow older, they get sick so often. And as children, they're very sensitive to this kind of thing. So the child learns that there's something wrong with him or her. All right. And then as you get involved with the health system, you may be labeled as addicts and whatever. So it's a multifaceted kind of issue. Unfortunately, I'm not aware of any recent research actually studying stigma as a research subject, but we know it's universal, it's multifaceted, and it's expressed in different forms at different ages and in different places.
Yes, I would agree with Dr. Adekile. And one thing we notice, we administer the newborn screening follow-up for the state of Indiana at my center. And one thing that we have observed in over the course of the 5 or 6 years that I've been at the center is that there's definitely a difference between the families of like the parents who were born in Africa versus parents who were born in the United States, where we have some of families from Africa who don't want their children to get sickle cell care because they don't want anyone to know that their child has sickle cell disease. And I think it's precisely for those reasons that Dr. Adekile mentions and lists. And I feel like in the US, the families who have had many generations living in the United States, they don't know about sickle cell disease because of the lack of awareness. And we also now, because of newborn screening and penicillin prophylaxis, most children in the United States do not die of sickle cell disease. And so that it's not seen as kind of the quote unquote bad disease as maybe it is in other parts of the world. And so I certainly have noticed that difference. And I agree, I'm not aware of any recent research about stigma. I think There's certainly been research about provider bias towards people with sickle cell disease, especially in the emergency department when they seek pain control, and they're often viewed as pain seeking and drug seeking, but not stigma per se.
I think if I could speak from a non-medical perspective, I think one of the key things is the newborn screening. So the parents know immediately, parents and their doctors know immediately that the child has sickle cell, and they can make plans for lifelong treatments along the way. Because, I remember the story of parents bringing their 3-year-old child to the hospital in Toronto because he had excruciating pain in his arms. And the doctor said, well, he must have fallen. They said, well, I can't remember. And the doctor said, well, I can't see anything. We've taken x-rays. There's nothing wrong. Here's Tylenol. Go home and your child should be better. Well, the next day the child was no better, and they brought the child back. And it was just good luck that the doctor who was on call at the emergency department that day had just finished training on sickle cell. But it shouldn't be that you have the good luck to find the doctor who has just finished training on sickle cell. So I think if parents knew immediately, then they can look at long-term planning for their child, and they can and we talk about everybody should have a doctor. Unfortunately, that's not a reality. And there are a number of people without family doctors. And so they're just going into the emergency room, which is a waste of resources, because you could hire a lot of doctors for the money that you're paying for people who are just going to the emergency departments. It's just, I think the whole thing, a number of people mentioned the importance of educating. And it's educating the public, it's educating the parents, it's educating medical people, including pharmacists, for the person who mentioned the case of going to the pharmacy and not being treated well, being stigmatized. And Dr. Adele Kale, you talked about, and Dr. Meyer, you spoke about people going to, particularly teenage children, going to the emergency department and looking for painkillers, and the assumption is made that they are druggies, and which is really bad, because by the time they actually get care, it's gone on for so long that then it really is a crisis situation.
Yes, we tell many of our families when we do the newborn screening education that they may be the sickle cell expert in the room when they go see the doctor, and it's shocking to them. And that's why we try to provide so much education and empowerment, and why families have to advocate for their children and their loved ones to get the care that they need.
Yeah, those are really wise insights all around. And, working in sickle cell, whether it's as an advocate, as a policymaker, as a healthcare worker, advocacy is job number one every day. So we have so many tremendous questions that have come through the Q&A, and we haven't had a chance to get to all of them. I'm going to invite the panelists to have a quick look in there, and feel free to type in an answer if you do see a question that you feel inspired or qualified to respond to. With our last minute, for those who we haven't had a chance to hear from in the Q&A, Ms. Laura, Ms. Rugi, from Mr. Riyadh, and from Ms. Cynthia, I just wonder if you could each in turn reflect on, based on what you've learned today, is there one thing in the advocacy work that your organization will be embarking on in the short term with regards to all of these? So maybe, I don't want to put anybody specifically on the spot, maybe though, Ms. Laura, if you wanted to share any reflections.
I would reflect a lot on the last topic of stigma, and I just wanted to mention that I think it's also lack of knowledge and ignorance or understanding, especially within our communities, that many of our people don't really know the word sickle cell. They know it in their own languages. So because we have a diverse and varieties of languages and tribes, I think it's important for people to understand what sickle cell is called in their own language, and then start to understand exactly what the disease is about. And once they start understanding that, it will be important to then maybe put together the knowledge of understanding that it's not actually a curse, or it's not something that is a witchcraft, but it's something that is genetic and it's something that is passed on. So knowing what it is called in the languages that we speak daily is important, and not just raising awareness that what is sickle cell disease. Because if you go to somebody in rural areas and you tell them what is sickle cell disease, they don't understand what you're talking about. But if you tell them what is sickle cell disease in their own language, maybe then they will understand, and maybe we will start to break the stigma by advocating in that way and raising awareness in that way, especially with African countries. Thank you.
Thank you. Mr. Riyad.
Thank you. I just want to say something as a patient first. It's important for patients to be educated on their own disease, to learn a lot about it, why it's important to take certain medications. I know, for example, in the sickle cell, taking hydroxyurea is very helpful and very good for them in the long term. At the same time, you have to be your own self-advocate. You have to learn how to advocate for yourself. And sometimes, and I know it's very difficult when you're in pain, whether it's at the emergency situation or at a pharmacist, it's difficult to convey the right message. And sometimes it's how we ask for things might impact you. You're still dealing with people. It's a human on the other side. But I also want to say, as patient organizations, I think there's a lot to be done on educating the patients. And we need resources for that. It costs money to do online education programs, to host events, and also for educating the medical professionals. I touched briefly on that in my presentation. These are things that we need resources for all across, and in every center, in every city, in every country. So these are the things we need to. In terms of what we will be doing next, we are right now focusing on the needs for patients at the clinics that lack resources for adult care. And it is adult care that we're focusing on because children are usually looked after. Nobody has the heart to deny a child treatment. But when it comes to adult, it's like too bad, But anyways, these are the things we are focusing on. The other thing is access to new therapies, which we didn't really talk about today. There are new oral medications that can help reduce the use of treatments. But what I wanted to talk about is, and I think, and I'm sure the ASH and the CDC in the US are working on that, which is the gene therapy and the new things that are in the pipeline and genetic engineering. These are things that we need to start thinking about, because these are very costly procedures, but they are cures. They are potential cures that we have to start thinking how we're going to access that. And I think that's it for now. Thank you.
Thank you, Riyad and Laura. And I'm just realizing that we actually only have 2 minutes left. So while we have so much passion around the table here and so many ideas about improving things, I think this conversation will continue, no doubt, both between us and in future panels. I'm going to wrap things up with a few closing remarks. And again, just want to acknowledge all of the many dozens of participants who have logged on, many of whom Ms. Lanre welcomed by name. Many of them are colleagues, also our patients, the families, other advocates, other healthcare workers working in this space. I want to acknowledge this tremendous panel who has been just investing this large chunk of a Saturday morning, afternoon, evening, wherever you may be in the world, to engage in this rich dialogue between people from all different walks of life. And I think bringing all of these voices together enriches all of it, enriches all of the work we do, because we can see it from all of these perspectives. And as one last thing, this was at the request of Ms. Janet Jackden. I'm going to just quickly share my screen. We have here a thanks, of course. None of us would be here without Ms. Lanre. And so I just want to acknowledge her. And these are Janet's words. Ms. Lanry has been a champion and a fervent advocate in raising awareness about sickle cell disease and campaigning for equitable healthcare on behalf of sickle cell disease patients. Her tenacity and passion have been infectious, which has contributed immensely to sickle cell disease gaining traction not only in Ontario or Canada, but worldwide. Among her most admired traits is the heart with which she serves with. As a leader, she understands how to inspire and influence those around her positively. In a time where toxicity is rampant in many of our organizations and places of work, she has made SCEGO a safe space where every voice is heard and respected. She was born to lead. We can list her accomplishments, but we would be here for a very, very long time. Ms. Lanry, on behalf of SCEGO, so again, this is Janet's words, on behalf of SCEGO, but also on behalf of me, the whole sickle cell community, all patients in Ontario, Canada, and around the world, on behalf of the many families you have touched and many lives you have changed, thank you, is the least we can say, but we thank you and look forward to the many more milestones that will be achieved. And there were also thanks here, which I'll just pass along to you directly from Dr. Ziad Sol in London, Ontario, from Tanya in SCEGO, as well as from Marie Pascal Poku. And we do just thank you, because honestly, none of us would be participating in this panel or this event if it wasn't for your leadership, Ms. Lanry. So over to you to wrap things up.
I know we don't have the time, but I'm just lost for words. I didn't expect that, honestly. And I want to thank you, Janet. I want to thank PAC. I want to thank every one of you for believing in me and for working with me and for always, making things easier. I think we all in this together because we all believe and we all have, that empathy to support. So we're all doing this together. So thank you for continuing to be a partner and also supporting this work. So I don't want to take any much more of your time, but I wanted to also recognize as well the industry partners, because again, without them, honestly, it's very difficult. As you can tell in many parts of the world, funding for sickle cell disease, especially for the patient organization, is very, very far and in between. Many of the patient groups are not having funding to do what they need to do. But when you compare to other disease areas as hemophilia, cystic fibrosis, I was doing a presentation a few days ago, and I was even baffled myself showing my screen that cystic fibrosis Canada has an annual budget about 17.5 million. And when you look about sickle cell disease, all of the sickle cell groups, including the national, provincial, we don't even have 250,000 annual budget combined. That is a huge disparity. And so how do we effectively and sustainably, continue the programs that we do? It's very difficult, but we are doing it, even with no staff. Thalassemia Foundation is doing it with no staff, all volunteers, because we know that this work needs to be done. But when you think about pharmaceuticals who are supporting the education, supporting what we're doing, I wanted to comment Novartis, for instance, because not only have they supported Ghana by providing test kits for newborn screening in Ghana, they are also supporting even the patient organizations across the world. And so I want to commend the pharmaceuticals for the little support that they are giving patient organizations. It's really helping to do the work that we are doing. I also want to thank Ms. Rugi, Ms. Cynthia, who are also working very hard in Canada. I want to thank the European Sickle Cell Federation, India, and Brazil, and Middle East, and Mr. Rudy Cacheto, MPP, sorry. Should I say Mr.? It's MPP Cacheto. MPP Andre Kajin not being here today, but amazing champions. They're already saying to me, Lanry, what's the next thing we need to do? So when Dr. Velzek is asking, based on today's presentation, what is the next thing? We're already working on what is the next thing we need to do in Ontario. And I'm hoping across Canada, across the world, in your own countries, you will now start to think to say, what do we need to achieve next to improve patient outcomes in her localities. Dr. Hadekunle, we thank you for the great work you're doing in Sub-Saharan Africa, you're doing in Saudi Arabia. Dr. Emily Mayer, your work through HASH in the US is commendable, and HASH is leading, and we thank you for being the global voice. I cannot stop this without giving a special recognition to Senator Jane Cordy. It's funny, when she was speaking, she said, she asked me, how can I help? And I find these days, people don't want to ask me that question because I usually take it more than they thought, they could do. So I'm happy that you continue to support us at the national level in Canada and also in Ontario and in every province. Thank you, everyone. And again, we wish you a very, very happy World Sickle Cell Day. Mr. Dongri, keep doing what you're doing in India. God bless you all. Thank you, everyone. Thank you.
Thank you.
Thank you, everyone. Thank you.
Thank you.
Thank you, everyone. Thank you, Ms.
Sickle Cell Day.
Thank you, everyone.
Thank you very much.
Everyone. Thanks.
Thank you, Mr.
Thank you. Happy Sickle Cell Day.
Happy